Dr. Rose Casper is a hospital pathologist who is mostly cold and focused only on her job with little social skills. On the other hand, Sally Morales is a warm and calm nurse who puts patients at ease. The movie begins with a nurse trying to stabilize a pregnant patient in a mobile emergency room. Upon arrival at the hospital, the patient suffered a seizure after an emergency cesarean section leading to her death. The body is then taken to Dr. Rose. She takes photographs and conducts tests to determine the cause of death. While Rose was looking through the microscope, her assistant Scott's phone kept ringing, making it difficult for her to concentrate. She scolds him for not putting his phone on silent, but he replies that it's only for emergencies. Scott asks her if he can go as his son needs him at school, but Rose tells him to send his wife in his place. Meanwhile, Sally picks up her daughter Lyla from nursery school and rides the bus with her. We then see Rose ordering a salad at a restaurant without bacon, chicken, or eggs. A fat man overhears her and tells her that he'd rather prefer bacon with salad, but Rose replies that he shouldn't eat it. When he asks why, she replies that he probably already has cholesterol buildup in his arteries, and bacon will make it worse. She then asks the man to come closer and whispers in his ear to follow her to the bathroom. There, she medically extracts his seed and leaves without a word. When Rose returns home, she begins experimenting on the samples taken from the man, and also takes samples from her pet pig Muriel, and feeds her. Rose then lies on her floor and injects herself with the man's seed. The next day, Sally notices that Lyla has a slight fever. She picks her up and leaves her with the neighbor as she has to go to work. Since Lyla is not feeling well, she cries and pleads with her mother to stay, but Sally has no choice but to leave her daughter with Pauline. At the hospital, we see Sally on her phone talking to Lyla, who assures her that Pauline is going to take good care of her. She then starts assisting at the maternity ward and calls Lyla during her break. While Sally is waiting to call Lyla, another nurse tells her she is needed in the delivery room, so she hangs up the phone. Later, Sally accidentally drops her cell phone in the toilet and is unable to contact Lyla. Upon returning home, she immediately looks for Lyla at Pauline's house, but there is no one around. Sally is scared to find blood in her bathroom and she rushes to call Pauline, but she calls her to the nearest hospital, the same hospital where Sally works. In the pathology lab, Rose receives Lyla's body in a body bag, and when she reads the medical report, she learns that the girl died of bacterial meningitis. Sally waits at the hospital reception until the doctor gives Pauline medicine, and after the doctor leaves, she takes her home. She then goes downstairs to visit her daughter in the pathology lab, but Rose says her body has been taken away an hour ago. Rose gives Sally her coroner's number, but she tells him it's usually closed on weekends. She then calmly asks Sally if she needs anything else, and she replies, no. Still dazed, we see Sally talking to one of her colleagues. Sally tells her that when her cell phone broke down, she should have used the phone at the hospital, but she didn't, and was temporarily relieved of her duties as a mother. She added that she may have liked it. She feels deep guilt over missing and losing her daughter, and she blames herself for being absent when her daughter needed her most. In the parking lot, Sally noticed Rose loading a large bag into her car, which she ignored at the time. She tried to call the clinic when she got home, but she couldn't get through. She also checks her phone for messages and discovers that Pauline has left several voicemails regarding Lyla's condition, making her feel terrible. Next, we see Sally visit the county coroner's office to see her daughter, but she learns that the coroner's office doesn't have Lyla's body. At the hospital, the director speaks to Rose and asks her if she knows anything about the whereabouts of Lyla's body, to which Rosa replies that she doesn't know. Rose tells Lyla's mother that her record keeping is troublesome, and she can identify incidents in the past where the body was accidentally cremated. Sally became extremely upset and refused to leave until she spoke with Rose, who was the last person to see Lyla's body. However, when they go to her office, Rose is gone, and Sally finds her in the parking lot. Sally tries to talk to Rose, but she ignores her, and she quickly drives off in her car. In her grief, she repeatedly tries to contact Rose over the next few days, but Rose keeps cutting off her phone to avoid her. One day, she waits outside Rose's apartment, and when Rose comes home, she asks pleadingly what happened to her daughter. Rose refuses to help Sally, but when she hears Sally say, "I can hear the alarm coming from the apartment," she chases Sally away and rushes into the house. Sally pushes Rose into the apartment. She was shocked to see Lyla with some IV drips and medical equipment. She confronts Rose and asks what she did to her daughter, but Rose just apologizes and says she needs to examine Lyla, otherwise she could lose her life. Rose then tries to explain that there is a way to bring Lyla back to life. Sally, hearing Rose's words that Lyla is still alive, puts her anger aside and lets Rose examine her daughter. Rose explains that Lyla is perfect for her experiment. She says that Lyla's case is an experimental treatment she is working on, and that this resurrection is due to pure science, not magic. She points to her pet pig that died 2 months ago, but she successfully resurrected her using the serum she developed. Then Celie watches the doctor while she works on her experiments and asks her about the details of what she had done. Rose explains that the serum is derived from fetal cells, which triggers the regeneration of new cells in the body. She adds that theoretically, Lyla will eventually wake, but they still have to wait and observe the effects of the serum on her. She also tells her that she will need to stay at Rose's apartment, so she can help take care of Lyla in whatever way she can. Later, Rose is in a clinic for an ultrasound, where the technician declares that her baby is growing fine inside her womb. As time goes by, Rose and Celie go to work on different shifts, so one of them can watch over Lyla while the other is working at their job at the hospital. Celie starts stealing some hospital supplies on Rose's orders and brings them home in a big luggagey bag. At home, Rosie takes some pills and sits on the toilet, then goes to the hospital. She then forces the fetus out of her womb to use for her experiments. Some days later, Rose takes Lyla out of the ventilator and removes all the other wires connected to her body. Afterwards, they are happy when Lyla starts breathing on her own, even though she hasn't regained consciousness. Rose tells her story of when she started experimenting on regeneration when she was only 6 years old. It was on a starfish arm that she cut, which she observed every day for a year until it fixed its limb. The two begin to have an almost friendly relationship, but Rose remains awkward. While at work, Scott notices that Rose is bleeding between her legs. This is a complication caused by her forcing her fetus out of her uterus. Because of this, Rose collapses and is taken to the hospital for surgery, making it impossible for her to return to her home to give Lyla and her pig the serum. Celie is unaware of Rose's current condition, but notices that Lyla has regained her consciousness, which distracts her. Meanwhile, Rose wakes up in her hospital bed to learn that surgeons have removed her entire uterus due to an infection that developed in her cervix. She quickly leaves the hospital and goes home, but she notices that Lyla has woken up and that her serum has finished. In a weakened state, she tells Celie that Lyla shouldn't wake up before collapsing on the floor. Rose asks Celie about the data she collected when Lyla wakes up, and she tells her that she needs more serum to keep her alive. Celie replies that they should make more, but Rose explains that since the serum comes from fetal tissue and the uterus has been removed, they can't make the new serum. Rose tries to figure something out, but she has trouble finding a solution because only she knows that Lyla's DNA and her HLA markers match. She suggests to Celie some other options, but Rose ignores them all at first until she suddenly remembers something and abruptly leaves. When Rose returns, she finds Celie watching TV with Lyla. She turns off the TV, but Lyla makes a sound like she is about to cry, and when Rose turns it back on, Lyla stops and watches. After the show ends, Rose goes to the hospital to check on Celie to see if anything is wrong with her. She informs Celie that she has found a pregnant woman named Emily Parker, who matches Lyla in her admission records at her hospital. Emily is in her second trimester of pregnancy, and Rose has changed her results, so she has to go to the hospital for an amniocentesis. They can steal Emily's amniotic fluid to make her serum. Celie initially refuses, thinking it is wrong to make Emily worry about the baby, but Rose insists that the procedure is harmless to both mother and fetus, and they need a new batch of serum. Celie gives in for her daughter, helps Emily with surgery, and ends up stealing her amniotic fluid. Returning home, she notices Rose testing Lyla's motor skills as she hugs her daughter. Rose learns that the body fluids she stole were only 3 to 4 weeks worth of serum, so Rose plans to change Emily's results and have her take another amniocentesis. Celie morally objects as this means Emily must undergo amniocentesis every other day. She will have to go to the hospital every month until her pregnancy ends. Rose needs to do that, and she explains that once she gets the placenta, she can use it for a year. Suddenly, they notice that Muriel is vomiting because Rose forgot to give her the serum. Celie realizes the same thing could happen to Lyla and has no other choice. Slowly, Lyla shows some motor skills and can imitate sounds, making Celie excited, happy, and motivated to follow Rose's plan. Sometime later, Emily takes another amniocentesis, but she is unable to complete it. She is forced to go to the hospital, where she expresses her fear for her baby to Celie. Emily tells Celie that this might be her last visit, as she is scheduled to give birth at a hospital in the city. Celie is upset, but tries to remain calm, and when she tells Rose about this, Rose becomes furious and blames her for not doing anything to stop Emily. Celie is similarly angry and tells Rose that she has committed unethical acts, such as subjecting her mother to human experimentation. Rose leaves to avoid her altercation, but when Saylee comes to her senses, she realizes that she has done something wrong. She calls her a mad scientist, but Rose exclaims that she did everything to keep Lyla alive. Saylee remains silent because this is true, and Rose's expertise is needed to prevent Lyla from dying. While Saylee was doing her job, Lyla was able to crawl towards Muriel, but he bit her hand, so Lyla stabbed her pig with a metal rod. Rosie finds Lyla in the hallway, tells Saylee what she did, and she is strapped to the bed. Rosie grieves the loss of Muriel and attempts to repair her damage to bring her pet back to life. She discovers that Muriel's cells are still regenerating, but her brain is unable to communicate with her body because her spine is completely damaged. She then concludes that in Lyla's case, her brain was damaged by the disease that took her life, so the dosage needs to be increased so that it can regenerate faster. Since there are no more samples to make a new batch of serum, Rose asks Saylee to collect some bone marrow from Rose's body for experiments. As Rose continues with Lyla's treatment, they hit a snag when some of her attempts are unsuccessful. As the serum from bone marrow is not working, Lyla's progress is stuck, causing her motor functions to decline, and her body starts to weaken. Rose tries everything she can, but without any success. Saylee is desperate and suggests that they should look further for a match, but Rose asks her to just spend some time with her daughter, meaning that she is starting to accept that they might lose Lyla soon. Rose's job is also affected, as she has been making several errors in her work. When the director spoke to her, she said she just had a personal problem. When Saylee returns home, Leela's heart stops beating again. But knowing that this is not all over, Saylee quickly leaves the house. When Rose returns home, she finds Leela's body in the freezer, presumably to prevent it from decomposing. Desperate, Saylee visits Emily's house and pretends to hand over her medical records. Emily offers tea but feels severe cramps while preparing it. Saylee continues making her drink, but she sneaks something into Emily's cup. This causes her to have a seizure, so Saylee calls for help and takes Emily to the hospital where she worked. Back at the beginning, it turns out that the pregnant woman in her mobile emergency room is none other than Emily, and it is Saylee who is trying to stabilize her. They prepared her for premature birth, and doctors were able to save the baby while she underwent an emergency C-section. Unfortunately, Emily suffered another seizure and eventually died, and her body was taken to Rose's pathology lab for examination. Rose collects her placenta to make more serum, and when she returns home, she finds Saylee sitting in the dark. She asks if Saylee has everything she needs, and Rose says yes. Saylee adds that she didn't want Emily to die, she just wanted to induce labor to retrieve her placenta. Rose told her it didn't matter, and went to work on a new serum. Sometime later, the couple attempts to revive Lyla, and after successfully reviving her, Saylee welcomes her back to life.